All right, we're going to discuss now some issues of growth and nutrition. First thing is some principles, basic principles of growth in childhood, starting at the newborn. First thing to remember, the newborn will lose about 10% of its birth weight in the first few days of life. It takes about up to 2 weeks to regain that birth weight. Usually by a week to 2 weeks, it's already on the upswing and back to its birth weight. And that's something to remember when you are evaluating the baby, or they give you a weight when the baby is born. In a test question, they might give you a birth weight and then a present weight. Also remember that for the first couple of months, the baby will gain about 30 grams a day for the first month, and after that it gains about 20 grams a day. So that's a nice ballpark figure to remember. When they give you a baby's weight and a birth weight, and then they give you a next weight and the exam question, it might be leading you to a poor weight gain, so you need to know if that's adequate weight gain or not. A common way of presenting it is giving the baby's birth weight and then giving you the baby's weight either at 6 months of age or at 1 year of age. And the baby should double its birth weight at 6 months of age. So if they tell you that a baby was born weighing 8 pounds and now weighs, at 9 months, weighs 16 pounds, that tells you that there's a problem there because it should have happened several months earlier. And certainly by a year of age, they pretty much triple their birth weight. Again, another milestone for you to remember, because that could be information that's given to you on the exam as far as the weights are concerned. You don't need to know the growth curve itself, but if you know those couple of milestones, double at 6 months, triple at 12 months, then that gives you an idea of what's going on with that patient's weight gain. Is it appropriate or not? The growth rate starts to slow down from 6 to 12 months and thereon. And usually appetite decreases by 18 months of age. Many times parents will start saying that the baby's not eating as much, it's pickier. That's because it doesn't need as many calories as it did previously. At around 2 to 5 years of age, during that span, the height and the weight will increase steadily. The head circumference rate will decrease. The head doesn't grow as quickly in that time. That'll be reflected by the growth charts. A growth chart is very important for you just to look at it to see the patterns of growth and at what ages there's acceleration and deceleration. At 6 to 12 years, during that time, they have several growth spurts a year. This can sometimes be heralded by the patient starting to have an increase in appetite. Brain growth slows, and most myelination is completed by 7 years of age. Through 10 to 20 years of age, that's when we start talking about adolescence, and that's when they have another growth surge and acceleration. And the girls, usually their growth burst occurs earlier than the boys. The boys, their burst will be a little bit later and it lasts longer. And that's why, on average, males are taller than females, because their growth spurt is later and it also lasts longer. The growth chart is important. You may be asked to interpret growth charts on the exam. When we talk about disorders of height, we'll show you some growth charts. So that is a very good tool to determine appropriate patterns of growth. Remember that normal is anywhere between the 5th to 95th percentile. So that's a pretty broad range of normal. We measure weight, height, and head circumference. We do have separate charts for boys and girls because there are different normals for them. You don't have to know that formula for body mass index. They won't be asking you to calculate that. It is important to know weight for height. Really nowadays, when we look at obesity and describe obesity, we look for weight for height and for BMI. You do need to know what's associated with obesity. You don't need to know how to calculate it. They will give you probably a percentage of a BMI. This is a growth chart for males, and again, you can see there we have both height and weight. The height is on the top parameters. You have the darker line is the 50th percentile, but anywhere from actually the 3rd to 97th percentile is considered normal. Many places will say 5th to 95th. And this is the weight, and again, it'll be the age in years, and then you plot the weight or the height and find out where they are in the percentiles. Many times parents will ask you, how tall is my child going to be? And typically their height percentile at 2 years of age. If you trace that upwards to an adult height, that's probably what they're going to be. So you can guesstimate a child's final adult height by looking at their height at 2 years of age and then finding out what percentile that is and tracing it upward. Obviously, there are a lot of factors involved, genetic, nutritional factors that are involved in final height. Babies that are born with low birth weight tend to do a lot of catching up in the first couple of years, particularly preemies, and they will really catch up in several years' time. Even though they're off the growth chart, they'll go back onto it. The best indicator for acute malnutrition is a weight for height. That's why it's important to plot both weight for height, and there's a separate chart for that, less than the 5th percentile, and that's probably the best indicator for acute malnutrition. When we have problems with linear growth, the first thing that's going to happen is length rather than weight. And again, the BMI is what we use to know if you're underweight or overweight, and it's based on percentages. The Grulich and Pyle is a radiographic standard. What they do is they take films of the left wrist and they look at ossification centers and compare it with normals. So that if your child is, for example, being evaluated for short stature, one of the things you want to do is get bone films, and that tells you if the child's bone age is the same as the chronologic age. So it's another helpful tool that we use to estimate the child's bone age.